Welcome to Science, Health and Healing Library of Children's Health Core. I'm Dr. Majid Ali. The subject of this article is pulses in the ears. While tinnitus, noises in the ear, and vertigo, which is you feel the room around you is spinning or you're spinning, they are not so uncommon, very troublesome. Pulses in the ears, on the other hand, is not so common, but it can be quite distressing unless the person recognizes that this is not the beginning of a stroke, this is not the beginning of a brain tumor, this is troublesome as it is. In most cases, you can make a big difference. Here's what I suggest. Have your doctor check your blood pressure. And if your blood pressure is high, you really need to learn how to breathe slow to normalize your blood pressure, and the doctor may have to adjust the dosage of the drugs you are on. Now after that, I would recommend just a 2 weeks trial of Dr. Ali's insulin reduction program. Please watch that segment on this encyclopedia, Dr. Ali's insulin reduction program. Now the other two programs that you really should watch, one is Dr. Ali's tinnitus plan and Dr. Ali's vertigo plan. There is some redundancy or some duplication, but this is planned. Now if you regulate your blood sugar, if you breathe slow, if you reduce the level of insulin, why insulin? Because insulin in excess is inflammatory. It is not only visitizing, it releases too much adrenaline and it disrupts the functions of neurotransmitters. Excess insulin is toxic to you in many levels, including these unusual symptoms, including pulses in the ear. Most of the time when you see people, or I have seen people, they've had pulses in the ear symptoms for years, so you really don't have to worry about this being a symptom of a brain tumor or this symptom being a symptom of a stroke. The new pulses, yes, you have to look at them in a different way, and you should see your physician for that. But if for chronic symptom of pulses in the ears, no, there is really no reason for you to be occupied by fear. Come to think of it, there are two programs I want you to watch. One is Centenarians Not Occupied by Fear, and the second is Children Occupied by Fear. It gives you a larger philosophic, humane perspective to deal with these symptoms, as troublesome as they are. Now in the tinnitus and the vertigo program, I do recommend the use of castor oil around the ear, not in the ear, but around the ear, gentle rubs. You can also gently tap your temples. Loosen up your neck with little exercise, because any neck spasm will increase the symptoms of pulses in the ear, but also tinnitus and vertigo if you suffer from those symptoms. Children's Health Core was funded and founded by Talat, my wife, and I, with the mission of providing authentic information about nutrition, environment, and stress. Of course, we focus on children, but we realize that we cannot reach children without reaching their parents, their grandparents, and their teachers. And so I've started adding some articles on this encyclopedia which may not seem on the surface to be directly related to children. Support us. Send this segment to your email, Facebook, Twitter, LinkedIn contacts. Visit our website www.kids123.org. That's kids.org. Tell us how you can support us. On the home page there is a link, how can I help, and that will guide you through. Thank you for joining us, and please do join us again. Thank you.